All right, congratulations. It's 3 months after surgery. We've been following you for the past number of months. You've had surgery. Today's your 3-month birthday. So congratulations, and we've got some tips, some guidelines, and some important information to tell you. I'm Dr. Ortiz.
And I'm Dr. Arturo Martinez at OCC.
Wonderful. So let's start off by what do you want to recommend at 3 months?
Well, now, the first thing is that at this point, most of our patients have already lost a great deal of weight. One of the main focuses is your nutrition, and you're also going to get a video from our nutritionist that will tell you specifically what you need to do to stay healthy. But our main focus as surgeons is making sure that the procedure is not also being detrimental to your health by creating some type of malnourishment. So stay focused on the amount of nourishment that you need by having your multivitamins, your protein shakes, and make sure also that you're doing some activity to protect your muscle as you're losing weight.
You know what, that's extremely important, because surgery is not going to make you healthier. It's actually going to malnourish you, whatever surgery we did on you. So it's extremely important that you nourish your body back to health. How do we do it? Well, we've got a very nice, well-structured plan. Our nutritionist gave you a list of items that you should avoid. Obviously, a pre-operative and a post-operative package where you're including bariatric vitamins, the bariatric shakes, and of course, keeping yourself away from the white evils: sugar, flour, dairy, liquid calories, salt. These things are no-nos if you want to change your life dramatically. Some other things have happened already. You've probably changed your requirements for medications. Again, if you have not visited your local practitioner and you do have one, go ahead and let them know that you've had weight loss surgery and you're looking incredible. I don't know if you want to add something else.
Well, the only thing that we wanted to add is the restriction part of the procedure. You know that usually at this point, most surgeries generate a lot of restriction.
Restriction meaning inability to overeat.
Inability to overeat, and in some cases, still the inability to eat certain food items that you were eating before having the procedure. For example, a lot of our patients tell us that they have issues having a steak or asparagus because you really require a lot of chewing and having very small bites in order to get them down. But don't worry, if you still have that type of issue, it doesn't mean that you won't be able to have them ever. Restriction will lessen as time goes by. Right now, your stomach is still swollen, it's still recovering from surgery, so that makes the stomach rigid, and at the moment that you try to swallow something, you're definitely going to notice that. But as the months go by, the stomach will regain elasticity and it'll become more compliant to the eating process. So don't worry about that. Just do your part, small bites, chew well, slow down, don't mix solids and liquids, and you're going to be fine with the oral intake. But if you have any issues tolerating food at any moment, meaning you cannot transition from that soft or liquid, mushy food diet towards solid food, you should let us know, because we can give you some strategies, and we definitely need to find out what's going on with your procedure.
Call us on this number. And it's extremely important to remind you guys, you're going to lose weight, but not necessarily body fat. And you might have symptoms associated to this. If you're feeling weak, if you're not feeling up to your typical daily routine, there might be a malnourishment factor involved. Losing weight is not the same as losing fat. The only way to guarantee you're going to lose body fat is by good nourishment, using that bariatric protein shake our nutritionist recommended early on, and of course keeping your activity level not normal, above normal. It should be increasing as time goes by. You want to protect your lean mass, and the only way to do that is through that program.
The only other thing I want to talk about is bowel movements. We've been talking about them for the past months, and even up to this point, we get complaints of either constipation or still some form of diarrhea after eating food. Now, this tends to, if you have the constipation, there's no other way to treat this but by good hydration, having a little bit more liquid fiber into your diet, and also staying active. Because remember, if you move around, your bowels tend to stimulate a little bit better. Having that right amount of fluid will make your bowel movements also less pasty, and it'll be easier to eliminate. But if on the other hand you have some type of diarrhea, this should be discussed with us. A lot of patients before the surgery were a little bit intolerant either to lactose, or were also they had some form of intolerance to gluten, and it doesn't become so evident until they have the procedure. Why? Because the stomach tends to empty a little bit quicker than before having this procedure. So watch out for those things, and always communicate them to our nutritionist or to our medical staff so we can give you strategies, and also even plan some diagnosis studies if we suspect that you have any type of intolerance to certain food items.
And lastly, I just want to remind you guys that some of you had heartburn before the surgery. Some of you might get heartburn-like symptoms. Food getting stuck, food progressing slowly down the esophagus into your stomach, burping. All these symptoms can be normal and expected after weight loss surgery. But again, if they're uncomfortable and they've changed dramatically, or they're growing or changing and they're interfering with normal life, go ahead and let us know. Sometimes it's as easy as adding one simple medication or changing certain diet portions that you're having, and it should be resolved. So again, this would be the review. Congratulations, you're well on your way to successful, healthy weight loss, fat loss most importantly, and we will see you again in this video series of follow-up.